Well, good morning, everyone. Good morning. Happy Saturday. I am thrilled to welcome you to our inaugural cohort webinar for the Meharry School of Global Health. My name is Angelita Howard, and I have the pleasure, the honor to join you today to share some of our exciting programs and initiatives as we pave the way for future global health leaders. Y'all, I'm excited if you can't tell already. First and foremost, I would like to extend a heartfelt greetings on behalf of our president, Dr. James Hildreth, and our senior vice president and dean of the school, Daniel Dawes. Their unwavering support and vision have been instrumental in establishing our school as a leader in global health education. As many of you know, Meharry is proud to be the only school of global health in the United States. Yes, I said it. We are the only school of global health in the U.S. That's a distinction that reflects our commitment to addressing global health challenges through innovative education and research, social determinants of health, political determinants of health, and so on. Our mission really is evolved around equipping students with the knowledge, skills, and experience necessary to make a meaning impact on health disparities, both locally and globally. Today, we are super excited to introduce our inaugural cohort of students who exemplify the passion and dedication needed to drive progress in their vital field. You will hear about our unique programs, and I'm so excited to announce our newly launched concentration in women's health, which aims to address the critical issue facing women around the world. We believe that empowering women is essential to achieving broader health equity, and we're eager to share how our curriculum is designed to tackle these challenges head on. Throughout this webinar, we also provide insights on our approach to global health education, highlight opportunities for engagement, and discuss how you can be a part of our transformative journey. So thank you in advance for joining us today. I know that you all are on YouTube. Some of you may be on Facebook. Some of you may be on LinkedIn. So please make sure that you like, that you share, and that you like so that other people can learn about what we're doing here today. We're excited to embark on this journey together. And we look forward to hearing your questions and discussions. So, with that said, let's get started. I'm going to bring my colleagues, our peers, our students up to the stage and welcome Brittani, Jalah, Adaora, and Terrence. Welcome you all. Hello. Happy Saturday. Are y'all excited to be here? I am too. Yes, wonderful. So we're going to get started, but before we get started, I want our audience, our virtual audience, y'all say hey to our virtual audience. I want them to know a little bit about yourself. So if you can introduce yourself, your program, share what motivated you to pursue your specific program, and what most are you enjoying at Meharry Medical College in the School of Global Health. So we're going to start with Brittani.
Good morning, and thank you for having me, Dr. Howard. I'm excited to be here and talk to you all. My name is Brittani Littleton, and I am currently in my first year as a PhD student in the Health Law Policy and Management program here with the Global Health. I am in the inaugural cohort class of 2028. I am also proud to say that I am a Nashville native. I'm a mom of three amazing kids and a wife. And so, what drew me to this program is definitely my passion for health disparities. I became interested in health disparities in my MPH program with Meharry. And so, my focus has been in maternal and infant health outcomes, specifically for Black women. And after I completed my master's of public health here at Meharry, I had the opportunity to work with mentors like Dr. Woods, Dr. Rishi, and their guidance has really inspired me to continue my my journey into this program. And so one of the best parts about being here at Meharry has definitely been the community. I love my classmates. We see each other now 4 nights a week. We've definitely built a community atmosphere, and it's really, really genuine. And the commitment of the faculty has definitely been a world class for sure. That connection that you have with your professors has been like no other experience. Coming previously from Middle Tennessee State University, where it's a little bit larger, Meharry has a close knit family, which definitely works to your benefit because you get to engage more in the community and working on social justice issues. And it definitely equips us with the academic knowledge to practice, put everything that we've learned to practice. And definitely have enjoyed my experience here.
Thank you. Thank you so much, Jalah. As y'all heard already, Brittani, sorry, as you already heard, she went from the MPH program here at Meharry to the PhD program. All right, next we will hear from Miss Jalah. Jalah, tell us about yourself.
Hello, everyone. It's super excited to be here. My name is Jalah Bates. I am a first-year MPH student here at Meharry, hailing all the way from Milwaukee, Wisconsin. So came from the Midwest all the way to the South. And I chose to pursue the MPH program because pursuing MPH was both personal and purposeful. It's not just something for me to study, but a calling. I fell in love with the ability to see the bigger picture, to understand how systems, policies, and environments shape the health of entire communities. And I chose this path because I believe health is more than medicine, it's justice, access, and dignity. And I want to be a part of a movement that ensures everyone, especially those often left behind, has the opportunity to live a healthy life. So choosing Meharry was pretty easy in that aspect because I wanted to be a place where the mission aligned with my passion and where I wouldn't just be prepared to work in the field, but to transform it. And the School of Global Health and Meharry as a whole has done an incredible job of helping to foster that mindset. I'd say my favorite part of Meharry, I definitely have to echo Brittani, without a doubt, is the community. Every day I've had the privilege of being surrounded by brilliant and passionate individuals, even within my own program, since my program rides from a variety of ages, different backgrounds. So it puts me in an environment that I'm constantly being challenged, inspired, and it allows me to grow, which to me is definitely an invaluable experience.
Awesome. Thank you. Challenged and inspired. Yes, yes, we love to hear it. Adaora, let's hear from you. Welcome.
Yes, good morning, everyone. My name is Adaora Lee. I'm a part of the Master of Science program in Health Law Policy and Management. I'm speaking with you all today from the DMV, Maryland to be exact, and why I joined the amazing program, and I cannot be more fortunate to be a part of the inaugural cohort, is because I knew I wanted change. Just growing up, realizing that we didn't learning about different systematic barriers of depending on where you grow up could dictate how your health outcome could be. I knew I wanted to be a part of the change and understand the law and policy. And I fell in love with actually our dean's framework about political determinants of health and understanding the relationship between policy, government, and voting, and how important the vote actually counts. So I knew I wanted to put myself and push myself through this program, which it has been a wonderful type of challenge on how to gain the academic knowledge, but also learn from my cohort members in their lived experiences. And it has been nothing but a blessing. So I love the intimacy of our classes and being able to learn different concepts of social determinants of health. So excited to be here.
All right. Thank you. Yes, change and going through those systematic barriers. We absolutely want to bring those down. And Terrence, welcome.
Hey, good morning, everyone. So I'm super excited to be here and just, echoing my fellow classmates. Just proud about, being a Meharian. But who I am, I'm Terrence Hight. So I'm an entrepreneur, first year PhD in global health equity program here at Meharry. And I'm also a native of Rome, Georgia, but currently right outside in Metro Atlanta. So I guess I kind of claim Atlanta because that's where my businesses operate. I'm a husband and father of 4 great boys. So what motivated me to get in the program was similar to Adaora. I'd read Dean Dahl's book, Political Determinants of Health, 2 or 3 years ago. And that was a lot of the work that my company did in the community and is currently doing was health equity work. But what I realized, and this kind of segues into what I'm most enjoying, aside from the community, so I love the community, the classmates, but being able to now look at healthcare more upstream and being able to say, okay, we can be doing, there's social determinants of health, but what are the determinants of the determinants? And being in this program has expanded my mindset. I mean, people look at me crazy when I start, bringing up political determinants of health and all these different things that nobody's really, focused on yet. I'm like, hey, this is where we should be headed. It's looking more upstream and how we can really, truly solve the problem and not just necessarily put a Band-Aid on the problem. So that's what, been learning is how to do that and being part of this inaugural cohort, the first group of champions for health equity in this way is very, very, important and proud for me. So I'm really excited about being here with everybody this morning.
Good. Great. Thank you. I love that. Not putting a Band-Aid on, but really, really solving that. And that's what we want to do. So we're gonna segue in to hear a little bit more about you all's research, the impact, what's happening in your programs. We'll start off with our PhD students. Terrence, let me ask, talk about your research. What is the focus and why do you think that it's important for global health equity?
Oh, great question. So my focus is going to be around access to social determinants of health resources. So like I said, there's absolutely a place for social determinants of health out there. But we, again, have to provide those resources to the community, I feel, and then give them access to that and then enable them to then take those, what they learned upstream to lead towards things like sustainability. So that's, what my focus is in the program. And in terms of, what was the second part of your question, Dr. Howard?
So the second part is just, connecting it with global health equity.
Right. So looking at that, there was a study I read, and one of the articles I read last semester from the World Health Organization talked about half of the world's population is not even able to obtain health resources. And that's broader than just access to care. We're talking about overall, health resources. So when you look at that, there's a major health disparity in the entire globe. And that's why, again, I love this program being, with a global focus, because we're not just looking at what's going on in the U.S. I've learned about dozens of different healthcare systems that operate in different ways and different health disparities and, countries that are doing great and countries that are doing not so great. So being able to have that perspective has really, shaped my mindset to say this is such a big problem that everybody needs to be all hands on deck, whether in the private sector, in the business, a nonprofit, the government, or whatever, making sure that you're out there really fighting for this. So that's what we're really trying to do is just, again, see how we can connect people. That's my personal thing, is seeing how we can get people connected to these resources and then enable them to make the change and live healthier lives.
Absolutely. And I appreciate the comment around, this is just not a local, it has to be global, because if you're in the US, you're going to travel. Many people travel outside the US, vice versa. Many people who don't live in the US travel into the US. So we have to be cognizant of what happens not only here. And that's why one of the great things about our program, looking at it not just from our country, but from worldwide, right? So we absolutely love that. All right, Brittani, how do you envision your proposed research? Talk about it a little bit. How do you propose what you're doing, contributing to real world change in health policy and/or practice?
Absolutely. So I'm so excited. Again, like I've transitioned from the MPH program. My capstone was focused around maternal health, and I've decided to expand that. And so my research centers around using legal mapping as an evidence-based tool to improve maternal health outcomes, whether that's here in the US or globally, and particularly for Black women. I am especially interested in how Medicaid policies like postpartum coverage, birth equity initiatives, and accesses to doula services can vary across states, and how those legal and policy differences influence maternal mortality and morbidity. And so my dissertation hopefully will incorporate the legal epidemiology methods like policy surveillance and legal scans. And I'm also thinking about designing some type of mapping tool that overlays maternal health outcomes with these policy differences that you see across states, the different patchwork of abortion laws and things like that. And so my goal really is to identify what policies are truly working and provide that data to advocate to policymakers, basically. And so given the current political climate that we're in, I'm also examining how the restrictions on reproductive health access, including the impact of the recent overturning of Roe v. Wade being overturned, affect maternal mortality, especially in states like Tennessee that is restrictive. And so my hope in that is that with this research, we can offer a practical policy recommendations and solutions that improve maternal health while also navigating the very contentious policy environment that we're in right now.
Yeah, that, again, thank you for that. And I will say we have here at Meharry, the School of Global Health, that has been on our mind. And this is why, one of the reasons why in my opening marks, I talked about real briefly our women's concentration. Our dean and our president really understand and know the value of this work and realize that if we don't approach it, if we're not at the center, the helm of it, then we will continue to widen that gap, those disparity gaps. So I'm happy to hear about your research. I'm happy that we in the school are taking it further by adding a concentration within our degree programs and our master program especially, and then hopefully to bridge it to our PhD program. So I'm going to ask this question for both you, Terrence, and Brittani. Talk about the collaborations you've had with our faculty and or community organizations. I know you've only been here Brittani, you were here in the MPH program, but as it relates to the PhD program, just under a year, we started in August. So talk to us about your collaborations that you've had with some of the faculty. Terrence, we can start with you.
Yeah, absolutely. So the collaborations I've had is really, it's happened with me like during office hours or like any type of evaluation of some of the papers that I wrote. Because I wanted to make sure that everything for my dissertation is in alignment, a lot of my papers have been focusing around different parts and different components of what my dissertation will eventually be. So therefore, when I have the conversations with my different professors, I'm able to gain insight from these esteemed individuals, that are champions out there from what I'm actually focused on. Is that actually even working? If I'm heading the right direction? So that then allows me, as an entrepreneur, to go actually put that into practice. And that's what we're doing here in the Metro Atlanta area, is actually putting into practice different things that I'm learning in class real time, just based off of conversation that I'm having with my professors. So that's how I've been able to do it.
All right, thank you, Brittani.
I would have to agree with my classmate Terrence. So I've had a lot of interactions specifically with Dr. Celeste Phillip. She's been a great mentor. She was my professor in the health equity, health disparities class. And so we really connected because one of her interests is maternal health. And so that immediately stuck out to me. And so I had to kind of cling to her to look at my papers and to be able to give me feedback, valuable feedback in understanding, okay, what direction should I go? And so, again, I've tried to transition some of the community outreach and things like that from the previous cohort that I was in with the MPH to now. And so it has really been a bridge. Mm-hmm. And so I've been a part of Black Maternal Health Week and the community baby shower and mm-hmm. things like that to further my agenda and my goal to improve maternal health outcomes for Black women. And so I think it's been a great opportunity to collaborate with our professors who are very knowledgeable and who understand our journey and our goal and where we're headed. And so it's been a pleasure. And yes, it has been short, but we are moving on. And I will say to my classmates, because we are a hybrid program, we have people not just here in Nashville, Tennessee, but we have people across the United States and some people that are out of the country. And so to be able to rely on that community as well and their expertise has been an amazing benefit as well. So
awesome. Yeah, the one of the things that we pride ourselves on, and I'm going to take a privilege right here as it relates to faculty, is that we do have scholar practitioners. And what that means, you all, for those who are listening out in our virtual world, is that they are people who come from industry. They are faculty professionals who are doing the work in industry, who have done the work in industry, and who in turn also gives back in their teaching, but they're still out there practicing. They're still doing their practice, which that gives all of our students that real world touch, not just from the academic side, but from the industry side. So if they're advocating, if they're on, Capitol Hill, if they're in the hospitals practicing, wherever they are, if they're in the chambers doing lobbying, those are the type of faculty that we have so that our students continue to engage in real world experience. So thank you so much for that, Brittani and Terrence. I'm going to segue over to our master students. We're going to start with Jalah, and who's in our public health program. And Jalah, I want to talk about community engagement. Terrence and Brittani kind of talked about it from their standpoint of what being community organizations and things of that nature. But how does the MPH emphasize community engagement and its importance in public health?
Okay, so I want to start off by saying a lot of people think when they hear community engagement, it's like this component of public health. I'd argue it's more so the foundation. So meaning that a public health solution is only as strong as the community it aims to serve. Yes. So within the MPH program here specifically, I would say that all of my professors, everybody that I've interacted with understands that community engagement, understands that concept of community engagement, and it's never an afterthought. It's embedded in everything we do, everything we learn, and we discuss. So I've gotten to work in so many forms of community engagement where I've got to practice what I've been preaching in class or what I'm being taught in class within my community. Kind of going back to what Brittani was talking about with that concept of being engrossed in maternal and child health. I've gotten to do so many different aspects within maternal and child health in the classroom, learning about it through my epidemiology courses, learning how to utilize data and cleaning up data through my data management course. And now I'm applying all of that into my current internship with Planned Parenthood, working as their advocacy fellow. So between coursework and experiences, we're constantly challenged to step beyond the classroom and connect with real people facing real health challenges and being taught to not just analyze, but also to listen to the community. Again, for me, this emphasis on community engagement is what makes public health so meaningful, because it's co-creating these solutions with the people they're meant for. And within my program, I'm able to do that because they do such a great job of teaching us that if we're not in the community, then we're not really doing the work.
Wow. Y'all hear that? I love. If you're not in the community, you're not doing the work. So what she's saying is, I think it's very profound that community engagement is not an afterthought. It is before the plans are starting to be made, before students in the MPH program, faculty in the MPH program make any plans about doing anything. Community engagement is already at the set. So thinking about that, Jalah, and where you are now, have you thought about your career after the program? What are some of your aspirations after completing your MPH program? And how do you think, and you've kind of shared about it's from a community aspect, but how do you think the program has prepared you for your career?
So after completing the MPH program, I actually do plan to return to Meharry to pursue my PhD. Only because I just want to be able to further my education in areas I'm most passionate about. So for me, that's health equity, policy, and then system change, because it's essential for the impact I want to make and I'm trying to make. At the same time, though, I do aspire to find an entry-level job that allows me to put the knowledge into action of all that I've been practicing and to be able to practice what I'm preaching essentially. And I want to be able to be in a space where I can engage directly with communities and contribute to like health policy and ensure that the work I do remains rooted in lived experiences and change. In terms of how Meharry has prepared me, specifically the School of Health, they've done more than just instilling this knowledge into me, but they gave me the confidence to lead and then the skills to implement these changes and the perspective to see public health both through a research and community-driven lens. So I'm excited to take what I've learned and continue to build on ways to make a tangible difference.
I love it. She's already planning for her future. She says she's coming into the PhD program. Why? Because she wants to continue the work from a professional community aspect to learn more and build more so that we can continue to disrupt these inequities and such. So thank you so much for that. Thank you so much, Jalah. We'll be back to you. So I'm going to segue over to Adaora. You know, a lot is happening in our community right now, and a lot is happening from health law policy aspect that we all know, that we all see. So, you know, thinking about your program, the Master of Science in Health Law, Policy and Management, how has the background of your professors in this program enhanced your understanding of any health law challenges?
That is a great question. What first comes to mind, I have to shout out Dr. Khan. He has an extensive background as a lawyer at this institution, and he has other degrees as well, but he has really exposed us to different cases and how the policies that are established today and beforehand has really played a part in individuals, and it doesn't matter where you live. I mean, it does matter where you live, but how the law is upheld in different branches of the government from a state and federal level, but also he has shown us how to extensively think of the law. I'm excited. We just had a lunch and learn yesterday with Dean Dawes and just talking about persuasive language and really digesting what does the policies that are established on any level play as an individual, but also how it can negatively affect us depending on your level of income, but also exposing us to how our leaders, like it really matters who are we voting for and if we're matching with their ideologies and beliefs. So making sure we're sure on who we're voting for. They have done a wonderful job to make me critically think, but also to really be a policy leader in my field that I'll share later.
Yes. Wow. That's so much that you impact a lot in a short amount of time. So, you know, thinking about this policy impact, can you share an example of, you know, how you're planning through your thesis or capstone, any legal principles to influence health policy?
Yes. So I'm really interested in AI innovation. Like AI really has the ability to save time, to really help with the burdens for essential healthcare workers with some of the low-hanging fruits of jobs, not saying it's going to replace jobs, but truly being incorporated positively. So some of the legal issues that are kind of rising in today's time is the transparency of how data is being collected properly, like how much privacy are individuals and patients' information being shared, especially as it comes with oversight with diagnosing diseases and even how decision making. Some people feel like it's going to replace the human oversight, which I really want to make sure through I'm seeing through policy that we really have to ensure that it's properly being used in all aspects, especially in healthcare, even with data collection to ensure that it is fair and just data of all population groups, not just one kind, to make sure that they're suggesting proper treatments. So it has the ability to really save time with diagnosing, but also it still needs that human touch and that the proper algorithms are being used. So using proper assessments and audits to make sure informed consent is being implied with the digital technology, but also ensuring that we're optimizing this opportunity of this digital age that we're in.
Absolutely. I thank you for saying that, because a lot of times people feel and fear AI is going to take over. It's going to take over my job. It's going to take over what I do. A lot of fears happen, when the internet was introduced, and Google and different things of that nature. No, it's not going to take over. We still have to learn. We still have to be able to use it. We still have to be able to use it responsibly, and use it for our benefit, the benefit of health disparities, health inequities, to make sure that certain treatments are still optimized for people who look like you and I, who are underserved, marginalized populations. So it's about learning. It is about learning how to use the technology, how to use the algorithms, how to make sure that they're in line. So I definitely appreciate the comment around not taking jobs, but really being understanding how to use the tool, how to use the tools to prep us for the future, for future outcomes. I'm going to have a little round robin with each of you and ask a question. So I'm going to start off with you, Terrence, to talk about the future of global health. In your opinion, what are the most pressing issues facing global health today, and how can future students contribute to this solution?
Yeah, I think, one of the most pressing issues is around, what my focus is. I've been talking about a lot, which is access. Again, out of that 500,000 in the world that don't have access, 100 million are then pushed into extreme poverty. And I think a lot of the saying out there, health is wealth. I think there's a lot of truth in that. And it's understanding that if we can figure out the health problem globally, or, starting off in the community and expanding globally, we can figure out that problem, then we can have true wealth, from an overall, world perspective. And as far as that, as far as the students that are coming in, future students, I really think that them just being open-minded and taking the time to go out there and in your research, looking at things that challenge your perspective from where you are, whether you're in the southern United States, whether you're out on the West Coast, you have a different perspective of healthcare. But go look at Thailand or Africa or Germany, and these are some of the healthcare systems I've seen. And just look at the health of these different populations, everywhere. See how can we learn in this globally interconnected world. How can we learn, and how can we really address the problems at scale?
Thank you. Jalah, let's talk about networking and support. And you all that are in our audience, please feel free to put in questions. If you have questions for our panelists, or if you have questions about the program as we're going through this round robin, please make sure you put your questions in the chat. So Jalah, how has the School of Global Health supported you in networking and professional development?
I'd say they've been really helpful in terms of networking and professional development from the very beginning. I've been surrounded by faculty and mentors who are deeply invested in my success. So to give an example, when you are coming in for the MPH program, we do like a little system called Bigs and Littles. So your big is a second year, who's someone who's about to graduate from the program, and then you have you're considered the little, and they're kind of just there to help you navigate. And I think it's especially helpful in terms of somebody who's coming straight from undergrad into grad school, which was the case for me. So it was a completely different world, new experiences, but it goes outside of the classroom too. I've been actively connected with opportunities, from attending conferences to internships, externships, from both professors and my peers. Being exposed to public health leaders through guest lectures, networking events, and community engagement projects. And I've had the chance to build relationships with professionals who are shaping the future of public health. And these connections have allowed for doors to be opened, while also allowing me to see all the different pathways available in the field of public health, because I feel like sometimes we tend to focus on two different fields, or it's like those popularized fields. So it's allowed me to see all the differences in the stuff that I can do with my passions.
Thank you. Brittani.
So
Your
for me, go ahead.
Oh, yeah. What challenges have you faced during your studies, and how have they contributed to your personal and professional growth?
That is a wonderful question. And I am in a very unique sometimes position because I'm a non-traditional student, so to speak, or as I started that way, I'll say. So one of the most significant challenges that I have faced personally is balancing my responsibilities of being a student, a wife, and a mother of three young children. As I mentioned before, we have three little ones. And so there have been moments where I have felt, that I'm stretching myself thin and navigating through coursework and other research and being involved in family life as well as being involved in the community. And so, but however, those challenges have been my greatest teachers. I have grown a lot over the last few years in my writing, also just in my personal life, being able to learn how to be a better student by managing my time, staying organized, and simply also giving myself grace in the process. And specifically with this program, I will say the community of faculty has been very, very important in making sure that you maintain grace to yourself and that you maintain your self identity and being able to maintain your mental as well throughout the process. And so they've also given us grace in those times as well, as we know that it gets stressful. I feel like being able to learn study methods and trying to figure out schedules that work best for me have been a challenge, but I've definitely become more confident and it definitely been more established in my career and being able to lean into my research. And like I said, my writing has grown exponentially throughout the many papers that we have written, as well as our group projects that we have been on as well. And I'll say, speak to my students that have families, you can do this program. I used to think that, oh no, I can't do all of this at one time. No, you can do this program. Meharry specifically makes sure, like I said, the faculty has been wonderful in being able to help me to navigate the space. And so if you're on the fence about it, just know that we're here for you to help you to grow, and you can do it.
Thank you. Adora, so to date, what has been one of your most rewarding experiences being in the School of Global Health?
Yes, that I love that question because as the inaugural cohort, there was so much room to be innovative with how we collectively are in and outside of the classroom. So one of the most rewarding, I would say, was creating something called a research social happy hour. And that is where we meet outside of class, but also to have a more intimate space that is informal with our cohort members and faculty and staff, but specifically to help us understand how to properly collect data, because we're in data and research, especially from coming from different levels of background as we are spaced out within the United States. So we are really learning from one another with what are the up-to-date technologies to use with data collection, and also making sure we're covering and using credible sources. So it's been a wonderful space with that. And then secondly, I'll just add, somebody else wonderfully said, the relationships that we have with the faculty, they honestly care about us, and that is something that is limitless in my opinion. Shout out to Dr. Wansu. Just working alongside him, he's exposed me to community mapping. That's a part of public health I'd never considered before, in which you're literally making a mapping of the different social disparities. One of the projects we worked on before is looking at, specifically in Nashville, Tennessee, looking at the poor housing conditions, and also literally making a mapping of different photos using like Google Map and also other technologies in order to collect that data firsthand for us. But using that, you can take that information to share it with the local policymakers to show the disparities and the need for funding and support in different areas. And we're going to go and present that in a few weeks at HBCU AI conference. So I'm super excited for the opportunity and the willingness that our faculty here at Meharry will invest into us. And I'm just eternally grateful.
Thank you. So Terrence shared about how students can contribute to future pressing issues in global health. Jalah talked about how the networking is provided here in the School of Global Health, how you can get engaged, involved in the community. Brittani talked about, having family, having those challenges, but still pressing through no matter what is happening in life, that, making a decision to go back to school with family and still moving forward. And then Adaora talked about, ways of engagement, some of her rewarding experience, community mapping, what a community map looks like, how we engage in the social research happy hour. Now you can bring your mocktails or just your water, but those social research hours to help our students move further throughout the program. So in our last question, before we take questions from the audience, you all, I want you to take 1 minute and tell the audience, what advice would you give a prospective student considering your program or a program in the School of Global Health? So Jalah, we'll start with you.
Okay, so I know you said one, but I'm gonna do like my Holy Trinity 3 really quick.
Okay, go ahead.
So first, come ready to grow, especially here at Meharry, not just academically, but professionally and personally, because you'll be learning beyond the classroom, engaging with the community, and challenge the way you see public health. So I definitely would say embrace it. Second, take advantage of the resources around you. So faculty, mentors, and peers who are just as passionate and driven, because you're surrounded by exceptional people in a variety of fields. And as the saying goes, closed mouths don't get fed. So make sure you're speaking up, you're asking questions and seeking out opportunities, because you can definitely miss out on something. And then finally, don't be afraid to say yes. I'd argue some of my best experiences have come from opportunities I initially doubted, whether because I was nervous, unsure if I was the right fit, or afraid of being alone. But saying yes has expanded my network. It's opened doors and even helped me realize like what I do and don't enjoy in terms of the field of public health. But it also helped me to understand every experience, even the unexpected ones, have contributed to my growth. And that was also something that I learned when I got here. I was literally told by one of the second years, like, don't always say yes, no matter what it is. But to kind of just give a little bit more, like, don't always say yes, but don't be afraid to say yes.
Don't be afraid to say yes. Well, you got it in under a minute. Even if you can have several things, but you got it in right at a minute. But no, I love it. Don't be afraid to say yes. Volunteer. Be a part of what's happening. I love that. Love that. Terrence, what about you?
So I would say, one, get ready. You'll be in for a ride. I'm not going to say it's hard, but it is challenging, as it should be. And I have to always keep reminding myself that, went through undergrad, went through an executive MBA program. Now I'm at this, and I keep making a joke. I see why people like it. My name is Dr. So-and-so. Like, you're going to put the doctor in front of the name, because the amount of work that is put in and the level of expertise that you gain, is definitely worth it. But I would say that, and then, discipline and a schedule. So this is, the second semester. So I'm getting better about that, because, as an entrepreneur, my schedule is all over the place. So the good thing is I'm able to have the freedom to, move things around. Then, having 4 kids, and my wife's a nurse, so she's, going in the hospital for a whole day pretty much. So being able to, have a schedule in place and having structure and just being disciplined and saying, hey, this is something I want to commit to, because I see the impact that we're making, which is again, just every time you go in there and you talk to our classmates, or I'm in the group chat or whatever, it's just such a great thing. So those are the things I say. I know I slightly went over, so I'll stop right there.
No, that's okay. That's right. We are looking forward to calling you Dr. Hight. That's right. When you get it, absolutely. Yes, I love it. All right, Adaora, what about you? What advice?
I would say just see what happens when you don't give up. Like, just echoing off of Terrence, yes, this is definitely a challenging course, but it's needed because it's preparing us for the real world. Remembering your why, just as a woman of faith, I really had to first semester offer it just from the extensiveness of the papers and getting criticism and feedback, but also to prepare us for any level of writing that we want to do long-term. This has been a great program with that. Using your community, I just love the intimacy of our cohort. It's literally family. They could have not picked a better cohort for me to begin this program with. Everyone has been absolutely supportive. We can contact one another at any times of the hour. Many of us are in different time zones, so just really leaning off of your cohort members for that is so needed. Echoing off of Jalah, definitely using your resources. You know, we're considered as students right now, we have to be sponges and soak everything in, using aid that we need, but also, like I said, preparing for the real world, because the years will fly by, and I cannot believe we're about to finish off one full year of the program already. It's been a blessing, but you guys, this is the program for you if you really want to challenge yourself. And also, what a time just to be alive. This program and the things that we're learning, it is really playing out in the real world that we see today with politics and policy. And just to be around this fruitful community, it has been a blessing. So thank you.
Yes, I heard the song when you said we are family. We are a family like a giant tree. I was like listening to that when you said that, because that is what we are. That is who we are. That is what we do. I love that. Here's a great thing about challenge. Challenge brings about change. And so if you're not ready to change, then the program, it may not be for you. But if you are ready to change, and if you're ready to bring about change, then I absolutely believe the program could be for you. All right, Brittani, last, certainly not least.
Absolutely. So my advice would be to, we talk a lot about networking. Network. Sometimes it's not about what you know, about what your GPA previously was. It's about who you know, who you make those connections with. Always ask questions, be engaged. Your professors want to know that you're curious. They want to know that you're engaging in their content. And so going to those office hours, having those one-on-one conversations with them is extremely important to build that relationship. If you're timid or shy, that's okay too. Those one-on-one office hours will be great. And if you have a family, being able to have the time management and, as Terrence mentioned, the discipline. Jalah said, don't be afraid to say yes to stuff, get involved. I always say you gotta build your village, and whether that's your family, extended family, whether that's your community or your professors, they really, really want the best for you. And so don't be afraid to just say yes, jump in, both feet, whatever. And so that would be my advice if you're coming on for the second cohort.
Thank you. Jump in, both feet. She said, not one. She said, just go on and get in. Ain't no point of trying to get, when we're swimming and we're trying to get to the water. No, you go on and get in so that you can get submerged by the water and just get through it. So I love that. So there are a few questions before we, as we're wrapping up our time together. And we'll just take the questions. The first question is advice for students who will be joining SGH as part of the second cohort. So we kind of gave advice for those who are thinking about it, but all of you, this is your first year in your particular program. So, someone come off mute and talk to us about advice you would give people who are coming and who will be starting their starting brand new, the ones who've been accepted that we know are coming to the School of Global Health.
I can start, and it was, I forgot who just said it, but somebody mentioned, the networking piece. I think it may have been Brittani, but the networking. One of the things I've done after some of the classes is actually connected with some of the speakers. Because it was, first of all, it's mind blowing because you'll be reading the textbook and then the author of the textbook comes to speak in the class because he's a friend of the professor, or you're reading an article or whoever found this, world renowned information is now speaking to classes, lecturing. It's mind blowing people who we're connected with. Like I said, I've been able to connect with several, I think 3 people who have come in and spoken that are leading to now conversations and things like that. So just, be open to networking beyond, just the school to the actual resources that the School of Global Health provides.
All right, good. Because we do have several questions, so I want to kind of keep moving through. Somebody explain what hybrid means. Of course, I know what it means, but what does hybrid mean? What does it mean for you? that are in the hybrid program?
I can answer that. Hybrid just means that, so for instance, I work full time. Like I said, we have a family and I do school. So hybrid just means that we do school in the evenings. We have 3 to 4 days a week, depending on what program you're in. You do do your lecture with your professor, 2 to 3 hours in the evenings, and then you have your assignments and things like that you turn in. We have group work, and so even if you do work or, like I said, have a family, it is flexible. Excuse me, in that it's in the evening, and so is it a challenge because you're going from doing it whatever you're doing throughout the day to the evening? Absolutely, but hybrid option is definitely best for working professionals for sure.
And I'll just say at this point, the MPH is residential, so you will have to be in Nashville for that program. But we are hoping and growing. And so we're hoping that at some point we will bring that online as well, or in a hybrid format. The next question: with public health becoming politicized in the U.S., from vaccine hesitancy to restrictions on reproductive rights, how do you see Meharry's mission evolving to these challenges? So, I'm gonna push that to you all. And the reason why I'm going to do that, based on some of the things that you've talked about or learned in class, how do you see us working through some of those challenges?
I can answer. I saw that question. I got so excited. Okay.
Yes, go ahead.
So thank you for the question. Like I said, I got really excited when I seen it. And I think utilizing Meharry's mission to improve the health of underserved populations is more crucial than ever, especially with the increasing politicization of public health in the U.S. So as we see growing divisions over topics like vaccines and reproductive rights, it's really important to continue to lead by remaining focused on providing like cultural competent care, education, advocacy, by staying true to the commitment to equity. Meharry overall can address the root causes of distrust in healthcare, which often stem from these historical and systemic inequalities. So prime examples of having more people that look like us within these fields. Listening, I cannot stress that enough. As somebody who at a point in time wanted to go to medical school, wanting to be a doctor, but now like has a bigger desire of wanting to address community issues at a wider level, by taking it away from direct patient care to community care, listening to what the needs are of the community. Like I said earlier, a public health solution is only as big as its community. So if we're not listening to the community, we're not being there for them, it's pointless. Like if I'm going into a community and I'm saying, hey, I feel like y'all need more doulas in more doulas in y'all community to combat the concept of maternal mortality rates. And then they're looking at me like, no, we don't. We didn't ask for this. It's pointless. So being there to listen, to educate, and that's the critical parts of rebuilding that public trust and kind of using this multifaceted approach. So listening to these marginalized communities, ensuring there's transparency in decision making. You cannot make a decision without the people that it is affecting, and engaging in the outreach that emphasize these shared values. So leaders have to be strong communicators, be well-versed in science, but also skilled in addressing concerns, debunking information with compassion and evidence, because healthcare is more inclusive. To make healthcare more inclusive and trustworthy, to work towards dismantling those barriers to prevent like many more essential services. Sorry.
Oh, no. Thank you, Jalah. That is wonderful, amazing. I really don't have anything to add to that. I think you are absolutely spot on. It is a multi-tiered approach. And that is the thing that I absolutely love about being here at Meharry, is because of the multi-tiered approach that we must take, that we are taking, that we are conscious about. every day, which leads to not only social determinants, political determinants. As Terrence mentioned earlier, he said the determinants of the determinants. And so that is the work that we are doing. We must continue to do with keeping our community ahead in front of us. So there was a follow-up question to that question. What role should future global health leaders play in rebuilding the trust in healthcare? How can we build that trust? How can we rebuild some of the trust?
And I'll share with this one. I feel like Jalah really pushed it spot on with being transparent, but also leading with lived experiences, making sure the decision makers who are making these policies, that they not only look at the data, because sometimes the data is not in representation of the full population group, but also having people who are directly affected by the policy set and that will live through those experiences. Especially since COVID-19, being transparent about all aspects of vaccines, there's a lot of hesitancies with that, but also seeing the pros and cons. Policymakers, I feel like they do have real intentions to hopefully give back to their community and advance the quality of life. And I also think about the two parts of preparedness plus how you implement a program. So making sure there's constant evaluations on what your intentions are through what is actually happening in the real world, both on a micro and macro level on a global space. So making sure those leaders are transparent throughout the whole process is needed to build that trust.
Yes, transparency is a must, and continuing to build the pipeline of leaders who look like you and I, who will continue to support marginalized, who will continue to support rural communities. In order to build that trust, people have to be in their face to make sure that we are being transparent. We're saying what's happening, what's going on, even though sometimes it doesn't always feel good. Two more questions and then we have to wrap up. How have you built your community in hybrid environment? How have you all seen, we have, of course, things like the Lunch and Learn that you talked about. We have Group Me, but what other activities have you seen in the community to build that hybrid environment? For those of you who are in the hybrid program.
So I can speak to the PhD students. I'm in the Health Law Policy Management group. So like I said, we come to campus only a few times within the semester. And so, for example, at the end of this semester, we'll have 2 days here in Nashville. But how we build our community is definitely through lecture. Even though it's virtual, we're still all very much so engaged with each other because we're interested in knowing more about each other's lives and what we're doing. And also having those lunch and learns like we had with Dean Dawes, or the virtual kickbacks with Adaora, who has been wonderful in getting that set up. And so there are many, many opportunities to get engaged with your fellow cohort. So,
all right. Last question. I'll pitch it over to you, Terrence. How did you prepare for the PhD before starting? 30 seconds.
30 seconds. So one, again, back to discipline, go ahead and get some type of schedule in place. If you can, shut off your evenings. So what I do is I have my class schedules blocked off in the evening, and after that I have like schoolwork only. That's on my work calendar, personal calendar. So I know, during this time I'll be focused on something or reading something. So I would just say that being disciplined, putting the schedule in place.
Wow, that was 30 seconds. Well, you all, it has been such a delight to share our time with our virtual audience, but I want to thank our panelists who are School of Global Health students, amazing leaders in the community, amazing workers, amazing bosses, all of the amazing things that amazing can be. This time has been really, really helpful I hope for you to learn more about what we're doing at Meharry Medical College in the School of Global Health. There is our website below, so that if you want to learn more about what we're doing, you can certainly visit us on our website. If you want to talk to us, if you want to hear more about what's happening, please visit us online. Please reach out to us. We will get back to you quickly. Our team, if you want to hear more from our student leaders, they are more than welcome to talk, and you can hear about what we're doing. We are excited. I want to thank our dean. I want to thank Ms. Maya Vallier for helping us to get through this morning. But I absolutely want to thank Brittani, Jalah, Terrence, and Adaora for being just amazing students, amazing panelists. And I want to thank our audience for what you're doing, what you have done, what you're going to continue to do as we build the School of Global Health. Listen, if you haven't told somebody about what we're doing here at Meharry Medical College, take that time to do it today. We want them to know what we're doing, how we're doing, and we want them to be involved, even if it's not through education, if it is telling someone else about what is happening, what's taking place. Stay connected. There's so much happening in our world today that you and I both need to stay connected, stay up front, so that we know how to advance global health. So again, thank you to our wonderful, amazing panelists. You ladies and gentlemen, y'all rock. And I'm so thankful to be able to host, to share with you all on today. And again, from our Dean Dawes, Daniel Dawes, we thank you for joining us today to hear more about what we're doing at Meharry Medical College in the School of Global Health. We hope that you have an amazing Saturday and an amazing weekend. Thank you all.